Hello, we are Team Rory, and we will be conducting a presentation to bring awareness on how increasing CRNA autonomy can directly lead to an increase in quality care for our veterans. We will be delivering our 60-day action plan. We will begin with the background. Team Rory will meet alongside with other knowledgeable members to specifically address the real problem. Advocacy plans should be constructed on the efforts of protecting the public welfare. We believe that fighting for CRNA full practice authority is not solely about CRNA's personal gains, but a solution to the bigger problem. This problem is the right and access to healthcare that our veterans deserve and are not receiving. By understanding that in order to accomplish this plan, emphasis needs to be placed on the wrongdoing against the public that is due to the VA's administrative refusal to grant CRNA's full practice authority. Next, we will discuss our aim. The aim of our advocacy plan will be achieving long-term goal of full practice authority for CRNAs in VA facilities. This will be accomplished by short-term goals throughout the process. A short-term goal will be having VA administrators acknowledge the shortage of anesthesia providers. An additional short-term goal would be the VA administration acknowledgement that veterans' necessary procedures and care have been postponed directly from this anesthesia shortage or due to the current anesthesia system design. Another short-term goal will be quantifying evidence to exemplify the loss of revenue the VA is losing from not providing these potentially achievable anesthesia services. The objectives of our advocacy plan are specific measurable changes that are established by the 5 stages of policymaking. Stage 1 policy agenda is the assessment. We will focus our attention on public officials, scheduling meetings with VA administration in order to educate them on the negative impact veterans endure through the current outdated anesthesia design. Bringing to the meeting personal examples and veteran testimonies will hopefully resonate deeper. It may seem counterproductive, but building rapport with anesthesiologists will minimize hostility while providing the opportunity to explain that this advocacy plan is not aimed at jeopardizing anyone's career, but is to solely provide first class care to our veterans. Stage 2 is policy formulation. This is the diagnosis. This stage will be developing a course of action. This will encompass the identification of anesthesia shortages in the VA system. From this, adequate numbers of CRNA providers needed can be predicted to properly implement an anesthesia delivery system that is capable of providing more care to our veterans. The finances needed to hire more staff and run more operating rooms will also be calculated. Researching the most efficient way to implement this new system to resolve the current public concerns is of utmost importance. Stage 3 is policy adoption. This stage will encompass planning to develop support for a specific proposal. A letter will be sent to Ralph Cole, AANA Director of Government Affairs, for his support on the advocacy plan endeavor. In addition, we will reach out to Dana Woods, who is the CEO of the American Association for Critical Care Nursing, for her support. Having these leaders reach out to Richard Stone, who is the executive in charge of the VA's annual $68 billion budget, will assist in explaining the level of knowledge and expertise CRNAs possess. Stage 4 is policy implementation. It will be essential to continue involvement with the policy's application into the VA framework. Being involved will ensure that original goals will still be upheld and policy goals will not be incorrectly interpreted. Understanding how separate hospital facilities have implemented CRNA full practice authority will help construct policy framework from learning what worked and what did not at other facilities. Stage 5 is policy evaluation. This step will evaluate for effectiveness, barriers, and consequences. Our 60-day action plan will establish a team that will research the obstacles, benefits, and surprises faced by hospitals who granted CRNA's full practice authority already. Understanding how previous hospitals handled this implementation will increase the preparedness for monitoring this advocacy's plan initiation and help prepare for any possible mishaps that may arise along the way. This will facilitate the process of evaluating how CRNA full authority is benefiting the hospital financially and improving veteran anesthesia care. Our plan has established targets. Building relationships and alliances with VA members is a key strategy to achieve attention and action for one's plan. As stated previously, reaching out to important nursing organizations such as AANA and AACN will increase support. As well, reaching out to VA anesthesiologists will help voice their concerns and develop a relationship that is capable of finding resolution with the veteran's interests first. Additionally, we have allied partners. A crucial partner to ally with are the actual veterans. Reaching out to veteran groups and attending veteran meetings will lay the foundation for hearing their concerns while establishing rapport. It will be essential to find out if any veterans have been negatively affected from procedural delays, as well as the personal impact these veterans underwent while experiencing these delays. Listening to their personal experiences and inquiring if they would be willing to tell their personal stories at an advocacy plan meeting would generate strong impact. Utilizing these connections through active involvement in APRN groups will also be necessary to gain momentum. Lastly, we will discuss activities and outputs, explaining the firsthand knowledge APRNs possess and the possible solutions from their experience will be most effective. Explaining to the public and VA officials that in 1915, nurse anesthetists were the providers that perfected nitrous oxide and oxygen anesthesia. After CRNAs started gaining professional recognition, is when physicians started to be attracted to the field. Educational information, as such, is necessary to make informed decisions. This information can be provided at meetings with veterans and officials involved in the VA administration.
In effort to gain greater public support, we push to reopen a public comment period. By doing this, our team would engage with the public and provide an opportunity for the public to comment on a decision regarding CRNA's full practice authority within the Veterans Health Administration. We would start this dialogue with this following letter: an open letter to the public. Having provided anesthesia care for over 150 years, we, as certified registered nurse anesthetists, find ourselves providing safe, quality, cost-effective care. The American Association of Nurse Anesthetists is well known for its mission to advance and advocate for the practice of nurse anesthesia and patient safety. We write eagerly to you today to increase your knowledge on the anesthesia care provided by CRNAs and the political action in granting CRNAs full practice authority in Veterans Health Administration facilities. CRNAs are highly trained, advanced practice registered nurses who deliver care to patients in any setting in which anesthesia is provided using the same methods of a physician anesthesiologist. The current limitation of having a CRNA supervised by physician anesthesiologists only serves to prevent the progression of advanced practice nurses and limit health care to our veterans. We are asking for this legislation to be amended and for your support in this endeavor. Please write to your legislative members and Dr. Stone, the Executive Director for the Veterans Health Administration, and allow your voice to be heard. A fact sheet has been provided to aid in your understanding and hopefully your support. If you have any questions or comments related to the VA ARNP practice issue, please visit us at aana.org or call headquarters at 847-692-7050. Thank you for your time and consideration. Sincerely, the AANA Rory Group. On this attached fact sheet, we wish to increase your understanding of the work and benefits of CRNAs. CRNAs have been providing anesthesia care to patients for over 150 years. CRNAs are the primary providers of anesthesia care in underserved areas. Independently practicing CRNAs show no difference in anesthesiology safety than compared to CRNAs who are supervised or anesthesiologists. CRNAs safely administer more than 49 million anesthetics each year in the United States. CRNAs are the only anesthesia professionals required to attain clinical experience before entering an educational program. The key areas of expertise include every setting where anesthesia is administered. For example, administering comprehensive anesthesia care to patients before, during, and after surgical and obstetrical procedures. CRNAs have a long-standing relationship with the armed services, having provided anesthesia care since World War I and are the primary anesthesia providers in the U.S. military today. CRNAs receive high-level training and can provide the same required level of service as anesthesiologists at lower costs. Using the existing CRNA workforce in the VA to its full practice authority would increase patient access to care while not wasting current budgetary resources.
Here's a timeline of activities for our 60-day action plan. Week 1, days 1 through 4, identify influential groups and individuals of the AANA, VA, and government affairs who will be key stakeholders and support our policy proposal plan of granting CRNAs full practice authority. Week 1, days 5 through 6, recruit these key stakeholders by emailing and telephoning them to relay our policy proposal. Coordinate and schedule a meeting day with all involved stakeholders to discuss our policy proposal and plan of action. Week 2, days 8 through 10, send the Government Affairs Director a written summary of our SWOT analysis, short-term and long-term goals and objectives. Week 2, days 11 through 12, send a letter in support of our proposed action plan to all stakeholders, including AANA members, Veterans Administration, Secretary of Health, CRNAs, anesthesiologists, and other healthcare professionals. Week 2, days 13 through 14, participate in meeting with members of AANA, VA administration, government affairs, and other key stakeholders to formulate the plan of action and to discuss any concerns surrounding our SWOT analysis summary, identify goals and objectives. Week 3, day 15 through 17, finalize details of Advocacy Action Plan with consideration of the input received during the previous week's meeting with key stakeholders. Week 3, day 18, finalize budget and determine need for additional funding. Brainstorm fundraising activities and reach out to public officials and key stakeholders to locate sources of additional funding. Week 3, day 19, create and finalize a schedule for upcoming events to take place in the next few weeks. Week 3, day 20, create a social media account page that details our policy proposal, action plan, a list of scheduled events, and educational resources. Send out invites for our social media account to the public and key stakeholders to allow opportunity for comments, questions, and continued engagement. Week 3, day 20 through 21, reach out to members of AANA, VA administration members, and members of government affairs top officials, and other key stakeholders to provide an update of our progress and further lobby support of our plan. During these interactions, provide a schedule of upcoming fundraisers, campaigns, and other events, and relay the need for their event attendance. Week 4, days 22 through 23, create and send out an open comment letter to the public that expresses our policy proposal and action plan. Include a fact sheet to promote the public's understanding and support. Provide the contact information of key stakeholders and AANA Rory team members and the link to our social media account page in this letter to provide the public with the opportunity to engage and comment on the proposal of granting CRNAs full practice authority. Week 4, days 24. Week 4, days 26 through 28, participate in a follow-up educational meeting with influential members of the VA administration, veterans, and other top public officials to promote support of our Advocacy Action Plan. Week 5, days 29 through 32, draft an outline for a community event engagement speech scheduled to take place in 3 weeks. Week 5, days 33 through 35, send out invites for our community engagement event to all key stakeholders and Advocacy Action Plan members. Week 6, day 36, create a YouTube channel and upload SWOT analysis YouTube video. Week 6, days 37 through 38, send a link for our SWOT analysis YouTube video to all key stakeholders and post video's link to our social media account page to educate and promote awareness of our policy proposal. Week 6, day 39, deliver a speech at the community engagement event. Following the speech, interact with community members and individuals interested in our proposal in an effort to gain their support. Week 6, day 40 through 42, send mass email to all community event attendees to thank them for their time and support. Include in the email the link to our team's YouTube channel, a schedule of upcoming events, including fundraisers and meetings, and a list of other ways they can show their support of our policy proposal. Week 7, day 43 through 45, upload a video on YouTube channel that summarizes Advocacy Action Plan. Provide YouTube video link through mass email and through social media account page. Week 7, days 46 through 49, participate in stakeholder meeting with AANA, VA, and GA top officials and members as a final lobbying opportunity. Express gratitude for their time and participation so far and encourage their support on the upcoming vote. Week 8, days 50 through 55, establish a research team that will evaluate the effectiveness, benefits, barriers, and consequences of granting CRNAs full practice authority within hospitals and other healthcare facilities if our policy is passed and adopted the following voting day. Week 8, days 56 through 59, reach out to the public, healthcare organizations, professional associations, and healthcare professionals to remind of upcoming vote and to express gratitude for their continued support. Address any remaining questions and concerns and provide educational resources to all individuals as needed to gain their support as voters. Week 8, day 60, Policy Voting Day.
Letter in support of Action Plan. To AANA members, stakeholders, Undersecretary of Health at the Veterans Health Administration. As our nation grapples with the COVID-19 pandemic, as well as healthcare reform, increased access to healthcare and cost efficiency are paramount. As discussed in the Institute of Medicine report, Future of Nursing, Leading Change, Advancing Health, are policies that support the certified registered nurse anesthetist role to practice to the full extent of their education and training. The recommendations supported by the IOM are studies that illustrate the quality, safety, and cost efficiency of the care provided by CRNAs. CRNAs are competent professionals that practice in every setting where anesthesia is administered. Studies show no difference in patient outcomes when comparing anesthesia delivered by a CRNA versus a physician anesthesiologist. Currently, the U.S. Army, Navy, Air Force, Indian Health Services, as well as combat support hospitals and forward surgical teams all allow CRNAs to practice without physician supervision with excellent patient outcomes. The Centers for Medicare and Medicaid Services now allow states to opt out of the federal Medicare supervision billing requirement, meaning that CRNAs are no longer required by CMS to be supervised by physicians when administering anesthesia. 17 states have opted out of the federal supervision requirement, and the cost efficiency of autonomous CRNAs in these states have shown to aid in controlling escalating healthcare costs. Therefore, the Veterans Health Administration must continue to provide the best care for our nation's veterans by granting full practice authority to CRNAs. The American Association of Nurse Anesthetists would like to ask you for your full support in the plan to help CRNAs receive full practice authority throughout the Veterans Health Administration. Full practice authority will allow CRNAs to practice without the supervision of a physician in the VHA, regardless of the laws for individual states, improving cost-effective access to care. The AANA's fight to attain full practice authority for CRNAs requires the help of the AANA members and stakeholders in making public statements in support of full practice authority. These actions are essential in gaining support from the public, as well as the officials of the VHA in opening a public comment period and voting for increased practice authority for CRNAs in VHA facilities. Please consider the information and research we have provided to demonstrate how beneficial the independent practice of CRNAs can be. With your support, we can make full practice authority for CRNAs possible. Our success relies on the assistance and support of you and our professional committees. Our nation's heroes risk their lives for our freedoms, and our veterans deserve the best care possible. Thank you for your consideration.
Frequently asked questions. Is there currently a shortage of healthcare providers in the VHA? Yes. The VA is experiencing a shortage of healthcare providers in many specialties. More than 20% of VA medical centers have a severe shortage of anesthesia providers. About 3/4 of VA medical centers have unfulfilled CRNA positions. What has the VA done to address the shortage of healthcare providers? The VA has amended provider regulations to permit full practice authority to 3 APRN specialties to practice to the full extent of their education, training, and certification. The 3 APRN roles are certified nurse practitioner, clinical nurse specialist, and certified nurse midwife. Do CRNAs have full practice authority in VHA facilities? All APRNs, with the exception of CRNAs, have full practice authority at VA medical facilities. What are the effects of anesthesia provider shortages in the VHA? The shortage of anesthesia providers in VA medical centers has resulted in surgical delays or cancellations and operating room closures. The real culprit is a lack of CRNA full practice authority. This has led to delays in cost effective, safe, and high quality care to American veterans.